Welcome to our series of learning modules that focuses on the value of research in patient care. Our objective is to educate clinical staff on the scientific method and how to apply it to everyday clinical practice. Here in Module 8, we will explore how to prepare a poster for a professional conference. In this module, we will cover general formatting and aesthetics for a conference poster, create an illustrative poster using a clinical question from Module 2, and offer tips on effectively presenting your poster at a conference. At your institution, you will often have access to templates for formatting your poster. These templates contain standard items including the title of your study, contributing authors and their credentials, your department affiliations, and your organization's logo. There will also typically be columns or other boxes for you to insert text, tables, and graphs. Similar to an abstract, a poster contains major sections. First is the introduction, located in the far left column, where you'll provide background information on your study. Next is the methods section, also usually located in the far left column, or at the top of the next column. Then comes the results, which will include tables and graphs in addition to text. Finally, in the remaining columns appear the discussion and conclusion, where you'll discuss the implications of your results. The poster will end with a brief list of references and sometimes acknowledgments. Before we move to our clinical example, we'll first consider the importance of aesthetics as you create your poster. Conference attendees will often spend only a brief period of time viewing a given poster. As such, for the sake of clarity and readability, it's advisable to use text sparingly. Instead of uninterrupted blocks of text, you may use a series of bullet points to convey information in each section. Another important consideration is how to communicate your main results. One effective way is to place a table or graph somewhere prominently, often near the top center of the results section. This will again give time-pressed viewers the ability to digest your main findings quickly and easily. To round things out, you may also want to include images of new technologies or equipment that you might have used in your study. Now let's create an illustrative poster using the first clinical question from Module 2. We'll begin by inserting a title, in this case, Effects of Sodium Intake and Physical Activity on Blood Pressure. Our authors will be Jane Doe RN and John Doe MD, with their affiliation being Stanford Healthcare. Now we'll insert text into the introduction section. Prior studies have shown a relationship between sodium intake and blood pressure, and that exercise may play a significant role. This text is just a starting point, as you should also include information on gaps in the literature and what your study will add to the current body of knowledge. At the close of the introduction, you'll want to state why you undertook your study. Here you may list objectives. The primary objective of this study was to determine whether a decrease in sodium intake and an increase in physical activity would promote lower daily and weekly blood pressure. You may also state your hypothesis if applicable. Next, you'll outline the methods you used. This section will include information on your subjects, your outcome measures, and your interventions. This observational prospective study followed two groups of patients in a cardiovascular unit for 1 year. One group took in a clinically standard allowance for sodium and directed their own exercise routine. Another group took in 20% less sodium than the clinical standard and increased their daily number of physical activities. Primary metrics were average daily, weekly, and monthly blood pressure. Secondary metrics were patients' physical stamina and range of motion. After you've outlined your methods, you'll get to your main findings. Ending mean systolic and diastolic BP readings were significantly lower for patients with decreased sodium and increased exercise. Ending mean stamina and range of motion for knee flexion were significantly greater for patients with decreased sodium and increased exercise. Mean systolic BP was significantly lower for patients with decreased sodium and increased exercise in months 6, 9, 10, 11, and 12. Remember that an effective way to present your results is through tables and graphs. For this study, a line graph succinctly captures changes in outcome measures over time. Lastly, the discussion section is where you'll interpret the results of your study and consider clinical implications. We've noted positive effects of altering diet and exercise in our study. Decreased sodium intake and increased exercise led to significant decreases in patient blood pressure as well as improved stamina and limb flexion. This suggests that altered diet and exercise may minimize hypertension and enhance overall well-being. To close out the poster, you'll list the references you cited in the other sections, and you'll include any applicable acknowledgements. To maximize the impact of your poster, you'll want to prepare an effective presentation for conference attendees. You should be able to clarify and concisely summarize your project. That is, why did you do your study? What were the main results? And why are your results important? You may also use your presentation as an opportunity to promote other work being done at your institution, to share supplemental information about your project, and to network with other professionals. Things as simple as smaller scale hard copies of your poster and business cards may pave the way for future collaborations with conference attendees. Now that we've covered the basics of preparing a poster for a conference, we'll ask you to reflect on what you've learned. What are a few aesthetic considerations to keep in mind when you're creating your poster? A few considerations to bear in mind are using text sparingly, using a centerpiece table or graph to convey your results, and including photos of any technologies or equipment you used. When you're summarizing your study for a conference attendee, what items should you address? Important items to address are why you did your study, what were your main findings, and why your findings are important. True or false? Your poster presentation is a chance to initiate communication and potential collaborations with conference attendees. The answer is true. Presenting your poster at a conference is a great way to build up and sustain collaborations with other institutions. This education series is made possible by a generous gift from the Stanford University School of Nursing alumni, in collaboration with Stanford Healthcare, Lucile Packard Children's Hospital, and Stanford Medicine. Congratulations, you have completed Module 8.